Good morning. We've got quite the audience joining us online today. It is certainly apparent that there's just tremendous interest in the well-being of Collin County as our community evolves. Good morning again. I'm Dave Collin, President and CEO of the Communities Foundation of Texas. And the very first thing I'd like to do is to acknowledge and recognize the multiple attending public officials who have joined us today. I just want to thank you not only for your participation in time, but mostly for your service to our community. And we're here with you virtually this morning, obviously, along with our partners from J.P. Morgan Chase and Every Texan to present the Collin County Economic Opportunity Assessment. But let me first mention that CFT's mission is to build a thriving community for all. And we serve as a resource for our region and certainly Collin County. And we're here to work side by side with you to tackle the tough issues in our community. And one of the partners in tackling tough issues is J.P. Morgan Chase. And we have the distinct privilege of partnering with them. And we're extremely grateful for their investment and leadership in increasing economic security across our community. And we want to especially thank J.P. Morgan Chase for their partnership with us in commissioning this study in Collin County. And we share their commitment to addressing the economic challenges across our entire community. Now, over the past 3 years, CFT has significantly increased our investment in Collin County. Many of you know that we have an office in Hall Park, and we have two fantastic, dedicated staff members, Sarah Humphrey and Jerry Chambers, who spend their time in Collin County working very closely with the nonprofits, our donors, and the business and community leaders. We recognize that while there are great opportunities here, there's also growing needs, and to be responsive to what the community needs, we felt it was most important to bring attention to those needs as well as the opportunities, and they are both highlighted in today's assessment. And we so look forward to building and continuing partnerships with all of you that will work to address the issues presented today. Now, we'll start today's conversation with my colleague and CFT's Chief Philanthropy Officer, Sarah Nelson. She's going to share a bit of background about the assessment, and then we'll hear from Ann Benson, CEO at Every Texan, and she'll overview the report data, and then we'll hear from some local voices on the challenges and opportunities for Collin County, including Monica Field, CEO at the Texas Muslim Women's Foundation, as well as two Collin County leaders, Dr. Neil Matkin, Chancellor at Collin College, and Lamont Thomas, former president of Cigna Healthcare. Good morning, Sarah. Boy, that is a great photo of you on the slide. Please get us started with a brief background.
Thanks, Dave. As Dave shared, I am Sarah Nelson, Chief Philanthropy Officer at Communities Foundation of Texas. And many of you were with us in 2018 when we released the Dallas Economic Opportunity Assessment, designed as a comprehensive analysis of economic opportunity in Dallas County to catalyze conversations around equity, access, and outcomes across the community. The same kind of conversations that we wish to spark today. When J.P. Morgan Chase and Communities Foundation of Texas got together last year to commission a similar report for the Collin County community, we could not have imagined how much or how quickly things would have changed in just 1 year. We had planned on releasing this report in April of this year, but as we're all too familiar with lately, those plans had to be modified to be relevant. This report was created by Every Texan, who many of you are likely familiar with under their former name, the Center for Public Policy Priorities. Every Texan works to strengthen public policy to expand opportunity and equity for Texans of all backgrounds. And that is exactly what this report is all about. This spring, we ask Every Texan to update the data to help all of us better understand how the COVID-19 pandemic has impacted Collin County. The information they pulled prior to the start of the pandemic now serves as a baseline, showing our community's starting point pre-pandemic. Together with new data released since March, it is our hope that the collective snapshot now presented can help us understand where there are challenges and opportunities to create thriving, financially stable communities across Collin County. We are recording today's presentation, which will be posted on Communities Foundation of Texas's website if you have friends or colleagues who have had to miss. Everyone who registered will receive an email with a link to this recording, which will be located on a CFT webpage, along with the report materials and a copy of today's slides. It is now my distinct pleasure to introduce to you Ann Benson, who has been the Chief Executive Officer at Every Texan since 2013 and a longtime advocate for public policy changes to benefit Texans, young and old. Under her leadership, Every Texan has advanced school finance reform to help ensure all Texas children receive a quality education, passed landmark legislation to protect Texans from surprise medical bills, and helped to reduce the number of uninsured Texans. Ann is a proud Dallas native whose mother and extended family live in Collin County. We're going to be allowing Ann to drive her own slides, so you'll see that things are shifting over so that she can control where she's going. I've known Ann for years, and I can tell you that she is passionate and wicked smart. In her career, she has transformed organizations and embraced a wide range of innovative strategies to advance social change. She also has the street cred for this work. After law school, Ann served as law clerk to the Honorable Barefoot Sanders, then Chief Judge of the Northern District of Texas. She also previously served as Executive Director of U.S. programs at the Open Society Foundations, as well as the National Associate Legal Director of the American Civil Liberties Union, where she argued twice before the U.S. Supreme Court. Ann, will you walk us through the highlights of this report, please?
Yes, good morning, everyone. And thank you, Sarah, so much for your lovely introduction. We are just so honored to partner with the Communities Foundation of Texas and JP Morgan Chase to present this data. And our researchers completed the main report before the pandemic, as Sarah mentioned, and now that baseline data is timelier than ever, given the challenges facing Collin County. We also recently reviewed some preliminary data about the impact of the pandemic and the recession, and I'll share some of that too. And taken together, we really hope that this data will inform policy and strategies for an equitable recovery so that all residents of Collin County can be healthy, well-educated, and financially secure. And I live in Austin, and Every Texan is based here, although we do work with partners all over the state. But I just wanted to say before I jump in that this report about Collin County is extra special to me because I have many family members living in Collin County. My mom worked for years for the McKinney Chamber of Commerce, the Tourism Bureau, and then the McKinney Senior Center, finally retiring last year at the age of 82. And in 2009, she received McKinney's Quality of Life Award for being such an active citizen who makes a positive difference in her community. So she's a great role model for everyone in Collin County. I also have two nieces who teach in local schools. My brother and my two nephews work in Collin County, and I have a growing number of little grandnieces and nephews who represent the future of the region. So expanding opportunity and equity in Collin County really means a lot to me personally. So let's begin with some basics. What do we mean by economic security anyway? Well, when we think about economic security, we often focus on what we can see above ground, but beneath the surface is the environment, the soil, if you will, that creates the conditions for economic security: income, educational attainment, debt and assets, and health outcomes. So what is our goal? Well, our economic opportunity goal here is to create the conditions for people of all backgrounds to achieve economic security. And the data that I'm going to share will show how people in Collin County were faring based on those conditions before the pandemic and a little preliminary data since then. And the important thing to understand is that this community, all of you, have the power to expand opportunity for everyone by changing the conditions for economic security. And I want to say one more thing before I dive into the data. We didn't do this report to show you some pretty PowerPoint graphics. We did it to tell a story about the people who live in Collin County and what you're experiencing every day, whether you can make ends meet, how your kids are doing, whether you can, your parents can see a doctor when they're sick. So as you listen to the data, I really ask you to think about how it's reflected in your own experience. What has changed since your grandparents moved here, and how opportunities may be different for your kids. So I want to begin with demographics. Who lives here? So none of you who are listening in are going to be surprised to hear that Collin County is growing very rapidly and the population is changing. In the 5 years from 2012 to 2017, Dallas County added more people, a little over 200,000, as compared to Collin County's 146,000. But Collin County's growth rate was twice as high at 16%. Now, Collin County is majority white, but that is also rapidly changing with significant representation by different racial and ethnic groups. And as we know, research shows that when communities are more diverse, all groups living in them experience better outcomes. So that's a real plus for the county. While the Hispanic population is still the largest population of color, the Asian population is actually the fastest growing. In Collin County, the majority of the Asian population is Indian or Chinese, and there are also sizable populations of Vietnamese, Pakistani, Korean, Filipino, and other populations, including Japanese, Taiwanese, and Bangladeshi. And just to be clear, in terms of the data, the white population in Collin County has also continued to increase by about 7% over a 4-year period. But the rates of growth for other categories, Black, Hispanic, and other populations for the same time period was over 3 times that of the white population. And according to the Texas Demographic Center, population projections through 2025 show a sizable increase in all groups, Asian, white, Black, Hispanic, with growth in the white population gradually leveling off. But what the data show is that the total growth means that the total population is likely to surpass 1.2 million by 2025. That's a pretty amazing statistic. Now, it's also the case that Collin County is getting older. The age groups experiencing the fastest population growth, as you can see in this slide, are young adults 18 to 24 and older adults 65 and above. Median age, meaning half the residents are younger and half are older, is also on the rise in Collin County. And in McKinney, one of the fastest growing cities, the median age increased by over 3 years from 2012 to 2017. And this rapid growth in the aging population, as you all are experiencing, I'm sure, carries implications for both healthcare and other services, especially where people are located in rural areas with less access to healthcare and elder care services. I also want to share that the future of Collin County is the children of color in the community. There's been a net decline in the white child population. And while over 20,000 kids were added to Collin County's child population from 2012 to 2016, which is a 9% increase, all of that growth came from children of color, particularly Hispanic and other populations. Now, just to be clear about the data, what it shows is the net growth by race, and that growth is in the Black, Hispanic, and other populations. The majority of the population, as I shared earlier, in Collin County is still white. Now, Collin County's population of young people, of course, is the primary foundation for the future labor force, the tax base, and the consumer base, and will have a significant impact on the county's economy in the years to come. So we want to do everything we can in the community, of course, to expand opportunity for young people. Now I want to talk a little bit about income and economic security. Unfortunately, income inequality is widening. While many Collin County residents have high incomes, the suburban and rural areas of the county experience large gaps between high and low income earners, as well as between different demographic groups. Unfortunately, as you can see, on the far left of the slide, the bottom fifth of earners, those living at or below the poverty level, saw a 6% decline in inflation-adjusted income over the past 10 years. And that means that the poorest households in Collin County are sinking deeper into poverty, making it harder for them to become financially stable and to thrive. And while overall trends before the pandemic were pointing to a more balanced economy with better income equality, the fact that the bottom tier of households lost real income over the past decade is a cause for concern. Racial and ethnic disparities also persist for poverty rates in Collin County. Hispanic residents are 3 times as likely to experience poverty as white residents and twice as likely as Black or Asian residents. Beyond income, Collin County also has disparities in wealth, with over 18% of households of color having 0 net worth as compared to only 12% of white households. And we'll need to watch these trends over the next few years as the impact of the pandemic is fully seen. Since the pandemic, again, this won't come as a surprise to any of you, unemployment has been rising, and unfortunately people have been losing their jobs at alarming rates. Weekly unemployment claims in Collin County from March through the first week of September totaled over 93,000, with a peak of 11,000 claims, almost 12,000 in the week of April 4th. These numbers are over 8 times higher than claims filed for the same weeks in 2019. And there's a connection between job loss and income inequality. So there's a risk that these job losses will exacerbate income inequality in Collin County. Now, since the peak in April, the trends have improved with fewer filings, but unemployment could easily rise again if Collin County communities need to roll back or slow reopening due to a rise in COVID-19 cases. So it's important to understand that while unemployment insurance filings may be declining, this doesn't mean that all displaced workers have found stable employment. Now let's talk about which jobs are impacted by the pandemic. Well, you all know that before the pandemic, Collin County had a robust local employment market. Business counts from earlier in the year show over 33,000 firms operating in the county, mostly in the service industry, followed by retail. In 2018, the county had an employee base of nearly 400,000, and businesses that provide health services and service industries were expanding the most rapidly in terms of the number of workers. According to the Texas Workforce Commission, the industries most affected by unemployment insurance claims as of August 2020 include full-service restaurants, temporary health services, limited service restaurants, and elementary and secondary schools. And since March, again, no surprise here, the restaurant industry has been most affected by unemployment. Because jobs in restaurants and other service industries are often considered non-essential, they may be the last to come back after extended periods of economic downturn, putting their workers at greater risk of long-term unemployment. And there's also a risk to small businesses. Collin County is lucky, and this is a 2018 number, that it had over 20,000 small businesses and employed fewer than 20 people. These businesses, unfortunately, are at a greater risk of falling behind, and they may struggle to bounce back or survive without targeted small business support. They may be unable to maintain payroll or rent, and that could lead to more job losses and more residents losing their employer-sponsored health insurance coverage. Finally, schools, childcare, and other businesses in Collin County are at risk, of course. Many are struggling to find ways to operate safely at a distance. And while many businesses have pivoted to online operations, extended office closures and continued unemployment may result in permanent office closures, slowing home sales, and increased evictions in both retail and household, and also retail closures. So debt is another big factor that impacts economic security. And this slide shows the percentage of Collin County residents that carry particular kinds of debt. Over 2/3 of residents have credit card debt, and the average debt is over $8,500. Student debt has also grown exponentially as the cost of college continues to rise. I know that personally because I have a son in college. Collin County's student loan volume has grown from $2.4 billion to nearly $3.8 billion. That's up 57% over the last decade. And the increase is both from the growing number of borrowers as well as an increase in the average loan of each borrower. Collin County residents hold an average of $37,000 in student loan debt, which is an amount that's increased by nearly 20% in the last 10 years. And around 7% of Collin County residents' student loan debt is delinquent, or at least 60 days past due. And studies have shown that there's a correlation between these delinquencies and graduation rates. The rate of delinquency for those who leave college with no degree is twice as high as those who earn an associate's degree and 4 times as high as those earning a bachelor's degree. So now I want to talk a little bit about education and economic security. What's going on in our schools? Well, first of all, the majority of public school students in Collin County, 56%, are students of color. And we know that by working alongside classmates who have different backgrounds, all students can explore topics more broadly and creatively while practicing focus and collaboration. Prior to 2020, nearly 1 in 4 Collin County students was economically disadvantaged, and that's compared to nearly 3 out of 4 in Dallas County, as measured by the number of students eligible for free or reduced price lunch. Now, school districts in local areas with smaller populations have a greater proportion of economically disadvantaged students. So this is one of those data points that's very different in different parts of the county. The 6 largest districts, in bold here, had up to 1/3 of their students qualifying for free or reduced lunch. Smaller districts like Princeton, Blue Ridge, and Farmersville have over half of students qualify. So while the county as a whole shows relatively few students are economically disadvantaged, which is a plus, This masks the reality that students in different districts, and particularly rural ones, are having a very different experience. Trends also show that the percentage of economically disadvantaged students is increasing over time in some districts. So you see, for example, that Allen ISD had an increase from 15% to over 19% economically disadvantaged students over the past 4 years. Now, economically disadvantaged students are 3 times more likely to drop out than the average student. And unfortunately, disparities also exist by race and ethnicity, with Black and Hispanic students being more likely to drop out than average because of barriers. If past trends continue, only 30% of Collin County 8th graders, I'm going to say that again, 30% of Collin County 8th graders will go on to earn any kind of Texas higher education degree or certificate, and only 15% of economically disadvantaged students. That is an unacceptable number. I know you will all agree, because post-secondary education is increasingly necessary in today's economy, and students who don't have a degree or higher ed certificate will struggle to earn family-sustaining wages in adulthood in a very demanding labor market. Now, with the pandemic, one of the disturbing trends that we're seeing in Texas and nationally is the drop in enrollment in higher education institutions this fall. There's a risk that more students who started college are leaving without completing their degree and with student debt. Other students may not be enrolling because of financial constraints, and that, of course, will limit their ability to gain skills and earn sustainable wages later. So now I'm going to move to health and economic security, and that's the final issue that I'm going to cover. The inability to pay for healthcare has a big impact on a family's finances, as we all know and experience, and that increases the risk of medical debt, predatory collections, and even bankruptcy. And of course, there's a big impact on health outcomes. Going into the pandemic, the rates of health insurance coverage in Collin County were actually relatively good, at about 11% uninsured, compared to 17% in Texas as a whole, and nearly 22% in neighboring Dallas County. Though the numbers are better in Collin County, about 100,000 residents of a total population of just over 1 million were already uninsured pre-pandemic. But there is wide variation between cities, with Plano having almost twice the rate of uninsured residents as Frisco, for example. And in Collin County, working age adults 18 to 65 are the group most likely to lack insurance. Unfortunately, Texas legislators elected not to expand Medicaid under the Affordable Care Act, resulting in about 30,000 low-income Collin County residents falling into a coverage gap who otherwise would have had access to public health insurance. And uninsured rates have dropped for all groups in Collin County since the ACA became law, but disparities persist by race and ethnicity between and in between cities. And although gaps have closed over time, Hispanic residents are still 4 times as likely to be uninsured as white residents. The vast majority of those that do have health insurance receive it through their employers, and that means that rising unemployment will undoubtedly disrupt many people's access to affordable health care. So for example, if the over 100,000 claimants who filed for unemployment since March lost their health insurance along with their jobs, Collin County's uninsured population will have doubled since 2018 in just 6 months. And children in McKinney and Plano are more likely to be uninsured. I'm going to share a little bit about children's healthcare coverage here. Before the pandemic, Collin County had better healthcare coverage for children than Dallas County overall. Not that we're like paying attention, we're not competitive or anything, are we, folks? And there were variations in the rates between cities, as I said. Allen has very few uninsured children, while McKinney and Plano both have close to 1 in 10 children that are without health insurance. And with the pandemic, high rates of unemployment is going to impact the health insurance coverage of children as well as adults. Research shows that uninsured kids are more likely to be in poorer health than their insured peers, and they are also more likely to experience higher rates of hospitalization, greater unmet mental health needs, and even increased rates of truancy and decreased educational success. Uninsured kids often miss out on regular checkups, screenings for serious health conditions, and critical preventive care. So I hope that this data that I've shared has helped you see how conditions under the surface in that soil affect economic security in Collin County. There's definitely good news in the data that you can be proud of. Collin County is a growing and changing urban area with many opportunities. In particular, the rapidly expanding population is a great asset, providing a relatively young and diverse workforce that can drive economic growth for years to come, especially during these very challenging times. Collin County started from a strong place and has many resources as a region, but the pandemic and recession could increase the many barriers that are limiting upward mobility for some residents. So what this means for low to moderate income Collin County residents and for people of color who are disproportionately represented in that category is that it may be more difficult to overcome barriers to opportunity on their own. Access to quality schools, healthcare, good paying jobs, those are all increasingly interrelated and they're critical for economic mobility. Collin County has a lot of strengths and resources to draw on, and I have a lot of faith that by working together, you can create conditions for people of all backgrounds in the county to thrive. So what can you do? Well, I'm personally excited to hear what all of you have to say about that, and I'm sure you have a lot of great ideas, and I thought I would just share a few to get your juices flowing, so to speak. So first of all, I'm trying to get rid of something on my screen that's like hiding my slide all of a sudden. You can share and discuss this report with your networks, with all of your friends, your communities, your places of worship. Have conversations. Talk to your community members about their experiences. Host community forums to discuss solutions. Learn about the many policies that can expand opportunity in your area. And finally, engage with your elected officials to recommend policy changes. And I have to plug, since we're in the middle of election season here, please vote if you haven't done that. That's the final thing you want to make sure that you do. So thank you for joining us and doing your part to make Collin County a great place to live for everyone. I'm very excited to hear the community voices that are going to join now, and especially excited to welcome Mona Kafil, Executive Director of the Texas Muslim Women's Foundation, to share how this data is reflected in the experience of her community. Welcome, Mona.
Thank you, Ann. I appreciate it. So Texas Muslim Women's Foundation is a trauma-informed, culturally sensitive agency providing holistic and evidence-based program for survivors of family violence through 2 shelters, 27 transitional apartments, including rapid rehousing. We have 15 plus languages spoken by our staff and members of 43. Even though our referral footprint is nationwide, due to lack of services nationally, our shelter and housing are all in Collin County and open to all, regardless of race, religion, color, and gender. And since past 8 years, TMWF has partnered with City of Plano, McKinney, Frisco, Ellen to serve women of color, immigrants, and refugees with language and education barriers. I have lived in Collin County for past 17 years and have seen the mushroom growth of small businesses, large corporations, and retail, which is a testament to the vision of its leaders and the citizens. COVID has forced us all to reprioritize and repurpose our services. And this report on economic opportunity assessment could not have come out at a better time for organizations such as ours. For me, this has really connected many dots personally. I read this report quite a few times already, and every time new facts jump out, not only for the current issues we face, but also a lot of ideas for our programs to be redesigned. I would like to highlight specifically the addendum on COVID. And I think, Ann, you already have gone over it, that which states that unemployment claims increased in April due to COVID. And that confirms and supports our work, because from March 12th onwards, 67 of our housing clients lost their jobs because restaurants and grocery stores cut down their hours and completely shut down. And as this report shows, full service restaurants, temporary help service, all have been impacted. An average income for our housing client is $1,300. When families spend a high share of their income on housing, less is left over for essential living expenses such as food, transportation, and even healthcare. So while there is a tremendous economic opportunity in Collin County, low-income residents will still struggle. One of the major barriers that we find with our clients is limited understanding of English language, even with high school diplomas. And that really affects their job opportunities. And when I read this report, and specifically to unemployment by education, that made so much sense. Collin County has low employment rate, which is 3.5%, though people less than high school and college degrees tend to have higher rates of unemployment. Asians, as compared to others, minority is very high. And this is also confirmed by the COVID started because a lot of our clients reached out to us, totally overwhelmed by the onslaught of information about COVID prevention. We actually had to work with City of Plano to provide COVID safety in multiple languages. So provide our clients with posters and flyers. And that to me is a language barrier. They read English, but they do not understand English. There's another part of this report, which is a median credit score by zip code. And I think that's also on page 29. When I plan to make a copy and share it with my rapid rehousing staff members, and in our program, our clients have to lease apartments in their own name. Unfortunately, it's very common that the abusers have ruined the survivor's credit history. So these women who are looking for apartments, they have a hard time finding apartments who will not check their credit history. And when I see that map in Plano where we find such apartments, the zip codes, and specifically the zip code of 75074 is where most of our clients reside. And I think that was very clear with the mapping of in this report. So I think I will share this with staff, so maybe we can explore additional zip codes as well. Nonprofits such as ours is always responding to community needs. Our programs are designed to fill those special needs gap. This report plays significant role by providing the facts on the ground and honestly, a roadmap for strategic growth. One of the most fascinating part of this report in Collin County, growth by population, which Ann shared that from 2012 to 2016, that there is a growing population of seniors at 37%. And for past 2 to 3 years, as an agency, we have been asked to work on creating programs for the seniors. We have City of Plano working on senior programs. And I think this is a reflection of where we need to grow and how strategic we have to be in our program and in our planning. So I think overall, I would be sharing this, like Ann said, the last slide, I will be sharing it with my staff and making case statements actually out of this. So really extremely relevant for organizations such as ours. And the last, I really would like to thank Communities Foundation for your partnership with TMWF on many levels and you giving voice to the most vulnerable women in the community. Thank you.
Thank you, Mona, for your words and also for illuminating how the numbers in this report really do reflect the real lives of your clients and others like them. You also have given other nonprofits ideas about how they too may be able to use this report. You know, local leaders, all of you out there, you actually can help us understand the data better than anyone by connecting these numbers to the lives that they represent and illuminate where you see areas of opportunity and potential action that we all can take for our communities today. Shifting gears, I now want to introduce 2 other community leaders to help us go even deeper. I want to welcome Dr. Neil Matkin, District President at Collin College, and Mr. Lamont Thomas, former president of Cigna. Welcome to you both, and thank you for being here.
Thank you.
Thank you, Sarah.
And I just want to make sure I can see Lamont Thomas, and there we go. Dr. Matkin, thank you for turning on your video. So let's start with a question to both of you, and you can have a virtual Zoom fist fight about who answers first. What did you find to be the most surprising data in the report for you, and what aspects do you think will or should impact future community plans in Collin County?
I'll give way to my esteemed colleague.
Not a problem. So as I looked at this report, what stood out for me, Sarah, was the couple things: the widening of the income inequities, the increase in debt, especially in student loans, and the extreme impact that COVID has had and really has set back our economy. And all these play a part in a way that when you look at healthcare, the number one reason people don't have insurance is the cost of coverage. And now all this economic impact to individuals will cause, I think, more uninsured individuals. and highlight another group of individuals that aren't covered in this study is the underinsured. Those are the people that have insurance, but the deductibles or out-of-pocket costs are so high that they can't afford to use the insurance. So you're going to see, I think, going forward, a big pressure on the local economy to provide solutions and with stakeholders going forward, like the hospitals, systems, the insurance companies, employers, and community community organizations like MONAS to figure out how do we close this gap and get people engaged in their health.
Actually, if I may follow up on that statement you just made, what do you see as the potential implications for the community as we see the rising number of uninsured? And what concerns do you have if this trend continues?
Here's my concern. If we look at our businesses, a lot of the cost of uncompensated care that is given to people with no insurance when they go into the emergency room, or people, again, who are avoiding preventive type of care because they don't have coverage and are going in higher cost settings, that employers are going to have to bear that cost. I mean, that hospital systems can't, taxpayers end up paying for that, and employers end up paying for that. So you now have employers with COVID being an issue. Now they're trying to figure out how to open their business, continue their business, and then healthcare costs will continue to go up because they're going to pass that on to the individuals through higher deductibles, higher out-of-pocket costs. And then again, uninsured individuals, unless we, as mentioned earlier, do something on the policy level, will still fall into a gap that is be impossible to get out of. And so I don't see any, without a collective work of policymakers, the community, employers figuring out, again, back to my earlier point, how to get mitigate the impact to uninsured individuals. Because the community groups, the nonprofits, they're overwhelmed. They can't do it all by themselves. They need help.
Dr. Matkin, how does that line up with what you're seeing? What were the surprises in the data for you? And what do you think we need to be focusing on as we walk into the future in Collin County?
Well, thank you, Sarah. Lamont hit some of those areas, but we look at things through the eyes of the college, obviously, and how we can provide services. And I think that the most stunning thing that we saw was the biggest impact was not only on just lower socioeconomic families and individuals, but in the business community on those small firms that were 20 or less that were disproportionately impacted. And then following up on that, when we think about where our students come from and where our students work, because many of our students do work, we're a community college with 99.x% of commuter students. And 3 out of the 4 job sectors that were hit hard as a result of COVID, but were baselined in your report as being exceptionally vulnerable, are where the majority of our students are employed in full service restaurants, temporary help services, limited service restaurants, and even more concerning for the future, that future pipeline of elementary and secondary schools was another area that was listed. So I think those areas were the standout areas for us. Certainly the healthcare was a concern. Seeing the numbers there were a concern. We were already aware of some of the demographic shifts and the various communities, and the idea that Collin County isn't all upper middle class. We have pockets of real need.
Now, we know that enrollment in higher education institutions is down since the onset of the pandemic. Has that been true also with Collin College, or are there some differences there that you're seeing as a higher education leader?
Well, we were anticipating with the opening of 2 new campuses this fall, we were anticipating about a 10% increase. Across the state, I'm only aware of one other community college that showed any increase this fall. And we showed an increase this fall, but less than we were anticipating. And that increase was less than 1%. But we're very, very pleased to see it. And it means that we're still connecting. And I think that's a very big positive for us.
So how can data like this support you in identifying issues and opportunities where you may be able to pivot to meet community needs and also to support COVID recovery?
Well, what it does is it helps us target where to close the gaps. And maybe it'd be helpful for me to start by telling you some of the things we have done. we were exposed to this data in the draft copies of this report, and it frankly influenced a lot of conversations prior to the official report coming out. We were already adding, and we're still adding, additional access points, including a very centrally located to the county, first ever technical focused facility with a whole wealth of new programming that we believe are going to expand opportunities, because there's short-term degree and certification programs that can get students in and get them out and into the workforce. And they're all focused on high need, high wage jobs. So we're very, very excited to do that. But on the other side of the spectrum, we've almost finished constructing a campus in Farmersville, Texas, which has seen, along with Princeton, some of our highest growth in Hispanic population. And it's also, as you mentioned earlier, or someone mentioned earlier in the report, one of the biggest pockets of socioeconomic challenges in the more rural sections of the county. You know, we made a commitment in 2016 to make sure that every single high school, regardless of location, had the ability to take 30 credit hours or the freshman year of college or university at their local school. At that time, when we made that commitment, we had 26% of our schools with that capacity. Today, we're over 80% and still working to close that final gap. So there are a lot of things that we've done. We've also added this semester teledoc services as a first line of defense for the many students that don't have any access to healthcare. But we also added it for our part-time employees and part-time faculty. So step by step by step, we continue to add wraparound services with the goal of helping students to achieve their educational goals and lift themselves to a different level in the socioeconomic chain.
I love that. That's creative and innovative, and I hope others will be following in your footsteps, both for the employees and the students that other institutions may be serving. So for both of you, you're very active in the community, whether it has been through your employer or through the other nonprofit activities that you're involved with across town. Mr. Thomas, how can other members in the community get engaged with affecting change on the challenges and opportunities that we're seeing in this report today?
Sarah, I think the opportunity is for greater collaboration. I think it's great, some collaboration amongst the nonprofits getting together and thinking about, with the data, where can we create some synergy to have greater impact? How do we work with local cities and work together? And I think that's going to be the answer going forward, is greater collaboration with the stakeholders, the hospital systems, the employers, primary care practices that are in the community. How do we use community health workers to engage and meet people where they are and create a solution that closes some of the health disparity gaps? And I also think there's an opportunity here that's an underlying challenge as we look at the data from an economic standpoint and also from a health standpoint, is mental health. I mean, COVID it really exposed how the struggles that people are having with depression, anxiety. And with the data, it's alarming that we have challenges with the youth and seniors, where we know from mental health standpoint, those are our two most vulnerable groups of individuals. So I think the data should be able to drive a greater focus on those two age groups, as well as, again, call out for greater collaboration.
Dr. Matkin, how about you? How do you see people on this call being able to get involved and get engaged to affect change related to the topics we're discussing today?
Sir, I think it's a great question. And, you know, I'm going to give an answer that will not perhaps immediately seem relevant, as I'm wont to do. I've thought about this a lot. How do you help someone that's in an environment that doesn't encourage them? How do you help someone that sees a one-way street and a dead end? How do you help someone who's been, for whatever their circumstances are, have knocked on multiple doors and the doors just don't seem to open? And there was a study in 2014, it was a national study, and it revealed something that's amazing to me, and it speaks to this issue. The study, it was by the Gallup group, Gallup folks at the national surveys. And what they found was across all educational sectors, whether it was elementary school, junior high, high school, community college, university, or beyond, at every level, there were two factors that if they were present, students were more than 30 times likely to finish the award they were working on. And the first was that the student felt welcome in the environment. It was a welcoming environment. They felt that it fit for them. They were welcome in the environment they were studying. And the second, though, is more telling, and I think it speaks directly to your question. And it's that if a faculty or a staff member took them aside and helped them be excited about their future, they engaged and were 30 times more likely. And so I think that whether it's mentoring programs, whether it's just basic encouragement, or frankly, stopping somebody and telling them, you can do it. People get discouraged. They need helping hands along the way. And if we really stop and think about our own trajectories, none of us got to where we are today without some help. A lot of unsung heroes in Neil Matkin's life. And so I think that intentional effort to be that encourager, to be that person that lifts people up and helps people make them aware of the opportunities. Sometimes people just don't see what's possible over the horizon. At Collin, we have the lowest tuition in the state, and it's just an incredible opportunity for students. We have incredible assets and ways to help students get support through a grant program, so they never have to pay back. So it's partly an outreach, and we're working very hard on student engagement here to help potential students learn what we have to offer. So I think that's a group effort that we have to take.
Well, one of the things we saw in Ann's presentation is that the children of today are the future of tomorrow in Collin County, and that is a lot to think about and to be concerned about. Also, though, we really need to think about what it is that is ours to do for the next 12 to 18 months. Would love to hear a little bit from each of you, beginning with Lamont, about what you see are the things that should be focused on in the next 12 to 18 months, and also talk a little bit about both the challenges and opportunities that you see along that journey.
Yeah, based on the environment that we're in from a society standpoint, I think a lot more, there needs to be an increased amount of conversations. As the data showed, Collin County is becoming more and more diverse by the day. But in absence of good conversation and the intentional seeking of understanding that what value that diversity brings to our community, we're going to be challenged going forward. I think that's the first thing that needs to take place and happen is more seeking of understanding one another, understanding culturally and other things related to being diverse and what value that brings to not only the community, but to healthcare. Healthcare, we look at health disparities. COVID has really exposed that. And then we look at the data that was presented today. There's a big gap in health and disparity and big gap in healthcare. So I think that's the first step that needs to be taken. And Collin County has an opportunity to be a leader in that area if it wants to be intentional about closing the health disparity gaps, working with hospitals and providers to hire more people that look like the community, that builds the trust within the community going forward. In absence of those things, I think the success we've seen as a county will start to deteriorate. So I think we have an opportunity now to look forward and really start reshaping this to be a better place that's more inclusive and provides services that include everyone in a way in which people need to consume that service.
Dr. Matkin, you and I have talked about previously the need to think about reaching into communities that may not know about Collin College or may have heard of it, but have a little bit of a different opinion than who you believe you are. Can you talk about what your thoughts are for the next 12 to 18 months about that kind of outreach to those that don't know that you're there for them too? Absolutely,
sir. It's a great question. You know, first of all, you know my bias. I'm convinced and convicted and live my adult life believing that education is a path to prosperity. I believe it is central to helping lift people to a different level. And one of the things that encourages me on a daily basis is that I have the opportunity with an incredible team of people to provide those pathways and help people once they get to them to reach new destinations. But the question really is about how to get people to those new destinations. And a couple of things we just launched was a GED completion program for students 18 to 25. Technically speaking, by the way, a high school diploma is not necessary to come to a community college and get an award or a certificate. But it's about building confidence. It's about successive successes, helping people realize that they can have a positive impact on their life. So we've added a program called HighSet. It's a national tool that helps people achieve their GED for those students that were interrupted in their high school process. The other thing that I want to mention is that it's about figuring out what the barriers are and removing them, reaching out to folks and making them know that they're important to us. And the truth is that there's not a single student or potential student in Collin County, regardless of their socioeconomic level, of their background, where they've come from, their gender, their ethnic group, that isn't important for us. That is our mission. And so it's always about trying to figure out ways to reach those audience. Some of the things we're doing are some of the community outreaches. We've hired a student success officer, and we're starting to put people in place that are specifically trained and gifted in reaching students in hard to reach places. And we're going to continue beating that drum. And Sarah, I just appreciate the opportunity to speak to the audience even here today to talk about our efforts, because we can use all the help we can get. It's a huge thing to watch somebody go from a minimum wage job or unemployment to double that and making a living wage. And when you see their faces and you see them at graduation, or you see their notes they send back after a year on the job in the community, folks, it's heart-rending and it's heart healing. And so we're very excited to continue reaching out into the communities. I do think the additional campuses and across the county, for those students that are having difficulty going to college in the first place, transportation's a big deal. And by the end of, shortly into 2021, the first 8 weeks of 2021, we'll see Farmersville open. By fall of 2021, Salina will open. And pretty quickly, there's a community college in Collin County in the service region, including a joint center in Rockwall, that's close to everyone. Traffic is becoming a non-issue for us, and access is king. So it's just a matter of helping people understand what's there and giving them the tools to take advantage of it.
Well, thank you so much, Dr. Matkin and Mr. Thomas, for sharing your thoughts and participating in this conversation today. I will say that Collin County is so lucky to have such terrific community warriors like you. And we want to come up under and support your work and your thoughts, because at CFT, one of the things we say is that we're about trying to work for thriving communities for all. And one of the things, Neil, that you said that really resonated with me is about the importance to students of finding a welcoming environment. And I think that that's true, not just for students, but really for all of us as humans. And so at CFT, we really are about trying to increase the access and opportunity for all until those things are equal for all, and really work toward communities where everyone feels welcome and also feels like they belong. So thank you for reminding us of the importance of that. You know, there's a lot of there's a lot of data in this report that says that there are things to work on. We've talked about that here today. The other thing, when you get the report in your hands or on your screen, you'll see is that we actually have a terrific, thriving community already among many people in Collin County, and that is something to build upon. Certainly, the pandemic is something that has made those numbers worse in certain areas and not worse for all. And so that the importance of considering the equity component is just of supreme importance. So thank you so much for being a part of this conversation. And now I will turn it over to Alfreda Norman, Chair Extraordinaire of Communities Foundation of Texas's Board of Trustees and Senior Vice President at the Federal Reserve Bank of Dallas. And she will close us out with a few remarks.
Well, I want to thank everyone again for being with us today. Your Participating signifies how people are working in this community to work together. And I am so inspired by your attendance this morning. Financial security is critical to the stability of families, and it's crucial for building, it's a crucial building block for the underlying long-term vitality of our local cities and economies. This is a difficult and unprecedented time, but we remain optimistic that our region can and will recover. Data like this report can serve as a roadmap for where and how we can focus our efforts. So what now? While I don't have a crystal ball to say what will come of this study, what I can tell you is what happened last time we commissioned a study in 2018. Some of you with us today and many like-hearted others responded. You engaged, you dove into the data and requested more to understand it better. You took the information back to your organizations and your programs to make changes to be responsive to the community needs. And we hope that this assessment will inspire similar action for our Collin County community. Thank you again to JP Morgan Chase and Every Texan for their partnership in producing this report. As Sarah shared, this assessment is about opportunity. The future economic story of Collin County and our entire region is yet to be written. We invite you to work side by side with us to make it one filled with opportunity, stability, and engagement for all. Thank you.